This is Travis Robbins at Robbins Rehabilitation West. I'm here with Dr. Wairi Aruru, and he is a new doc that we have. I don't know if I can't technically call you on staff, but we feel like you're on staff because we feel really close to you. So he's going to start doing some office hours in our office to try to help out our patients, in physical therapy. A lot of times we're treating pain. And Dr. Ruru is going to talk about things that he does in terms of helping patients with pain. But first, we want to learn a little bit more about him. So tell us your story, Doc.
Yeah, absolutely, Travis. Thank you very much for the opportunity to really get to talk to you and your patients today. It's been a very fun journey for me from going to medical school in Minnesota. Really, medicine has been a passion, and I enjoy interacting with people. I enjoy the process of diagnosing, treating, working with colleagues, thinking about the body more than just the body, but as a whole person. And that's really something that really fascinated and drew me to medicine. So, I did my medical school at Mayo Clinic at Minnesota, and I did most of my postgraduate training, master's, surgical residency, fellowship at Boston, and made my way over to Pennsylvania, where I've served at the University of Pittsburgh, and also now currently run my own private practice in the Lehigh Valley. So really what has been intriguing and just fascinating with just the medical practice itself is really that patient-doctor relationship, and I get to do that a lot with pain management, and it's been really fun, and I'm looking forward to this conversation.
Yeah, when people have pain, I mean, I've been doing this for 25 years now, and I've had bouts of low back pain for sure. I've herniated disc in my low back, and when you have back pain, I mean, there's really nothing else you can think about. Like you can't think about your kids or your family or work or anything else until you get rid of that pain. So that's what I've kind of spent, the last 25 years helping people figure out, and working with other practitioners like you to try to get people out of back pain. I know what it's like to have terrible back pain, and I don't want anybody to have that. So, just getting right into that. I mean, a lot of what we see as an ortho outpatient clinic is backs, knees, and shoulders. Those are the areas of the body that kind of wear down as you get older, but also can get injured when you're younger as well. So, when someone is coming to you for back pain, what are the most common reasons that someone ends up on your table that has back and neck pain?
And quite frankly, that's a great question. And it varies with age. When you're younger, it's a lot more related to being athletic or being in something that could have provoked your body to have worked a little bit harder than it's supposed to. And when that's the case, whether it's playing sports, whether it's, just from a stationary activities like driving for a long period of time. But the idea usually is when you're younger, some of the things that can provoke back pain tends to be related to activities, and very common we would see patients come in with like a disc herniation from maybe a high impact event, whether it's an accident, whether it's playing sports, or whether it's even sitting for a long period of time and you go for that wrong twist at the wrong angle and the body just had a hard time adjusting to that change in motion. So, you can see that a lot, like a disc herniation. And then as we get older, you can see multiple reasons that can contribute to one of the reasons why patients come to me to manage your pain, from arthritis, which is inflammation and, at just ridiculous spots in the body. The problem with arthritis, you get close to a nerve, it gets very, very angry. And we see that a lot. And middle age, older age, and even quite frankly, from genetic exposure, you can see it in younger patients. So arthritis is very common. Sciatica, which is a very common thing that people talk about, is another common reason why when I see patients for back pain, they need assistance with, or neuropathy, that the nerve is just so angry and they have no idea if it's from their diabetes, if it's from something that mom and dad passed on to them unluckily. So there's really multiple slew of reasons patients come to me, sometimes even come to me with pain after surgery. So they've had surgery 5 years ago, 6 years ago, and they still have pain. And the question is, I thought it was fixed. Why does it still hurt? And again, it becomes really fun because we get to go through this journey together to figure out the etiology and then parse out how to really help patients. So yeah, so those are some of the common reasons.
Okay. And most people, when they get back pain, they're not like, oh, yeah, I'm just going to go right in and see the doc. They're kind of like, well, kind of hope it goes away. Maybe if I wait a couple days, well, I'll just eat a bunch of Advil and try some ice packs and some hot pack. Hope that it goes away. But what are some things that you can tell somebody, or some advice you would give somebody to be like, if you're having back pain, it's okay to maybe wait a couple days to see if it's going to get better, or it's something you should immediately get seen by a specialist like us.
No, absolutely. I think, back pain is like a story, and I tell a lot of my patients what's critical when you when you hear a story is you have to listen, and it's critical. So some of the red flags that I would say should prompt not just even getting a specialist, but going to the ER, for example, is you have pain and you can't really move your legs or you can't move your arms, and it's really brand new, never happened before. A lot of those are very, very urgent situation that requires kind of like a very time sensitive response. However, and then thank goodness, most of the pain that we see do not actually fall under that category. Most of the pain that we see are the ones where you have pain, you can't really explain why. It's numbness, it's tingling. You turn to the left, it hurts, or you wake up in the morning and your neck feels really stiff and you can't really turn it. When you get into scenarios where you have pain and it's pretty early in the journey, what you listen for is, can I actually try to help myself with improving the pain by working with, and I'm going to start with some of the things that patients would do. They could take over the counter medications. One of the things I always recommend is talk to a physical therapist. Okay, make sure you understand the ergonomics of your body. Recognize that your motion and your the structure of how you sit, how you actually sleep sometimes can impact your pain. And recognizing that movement and adjusting the nerves, the muscles, the joints at the areas where your pain is located can actually result to significant improvement. So I usually say, I tell a lot of patients, when you have pain, you can exhaust over the counter medication, but one of the other things you have to do is talk to a physical therapist. Physical therapy, physiotherapy, and rehabilitation, it stands the test of time. I tell a lot of my patients, it's so powerful with physical therapy and rehab that patients who actually have stroke, which means that there's issues wrong with the brain, they go through so much rehab and movement, because moving itself, it's almost like retraining the nerves, the wiring in your brain to start firing like normal. So when you think about it, pain is just not any different. So a lot of times it's physical therapy, and then when you've exhausted so many options and it's not working, you've tried everything that you can, whether it's over the counter, you've worked with your physical therapist, you've tried other conservative care, TENS units, massage therapy, and it still hurts, then it may not be a bad idea to seek medical attention with like an interventional pain doctor. And what I could do at that point is really obtain like maybe an MRI or a picture of the back, something to help diagnose why your pain still persists despite all of these treatments. And again, obviously, there's a spectrum that goes all the way to even an intervention that could be surgical. But again, what I would say is some of the things patients can do that pertains to managing your pain prior regardless of what the degree of symptoms are, is you can try conservative measures, over the counter medications, Tylenol, ibuprofen, heating pad, warm compress, cold compress, TENS units. And if you don't feel like you're getting any better, I always say, under the guidance of a healthcare provider, you should definitely consult with a physical therapist who can actually help you understand why you're in pain, as it pertains to a lot of things about your body's anatomy and physiology you're not aware of. And then the other thing I would also say is, as the pain continues to persist despite your ability to perform all this conservative management and it's still there, it's not a bad idea to consult with an interventional pain specialist.